Hello, everyone. My name is Fahad Mohammed, and today I'll be presenting our study on literacy, practice, and attitude towards thyroid self exam among adults in the UAE and its association with their family history of thyroid cancer. The study was conducted at Gulf Medical University under the supervision of our faculty listed above. And in this presentation, I'll walk you through the background, methodology, the key findings, and the clinical and public health implications of our study. For the contents, I'll first begin with the background and then followed by the objectives. Then I'll discuss the materials and methods, then the results, discussion, and finally with the conclusions and recommendations. So to begin with, thyroid cancer is the most common endocrine malignancy worldwide, with papillary thyroid carcinoma being the predominant subtype. Over the recent decades, however, the incidence has been increasing, largely due to improved detection methods such as ultrasound and fine needle aspiration. Key risk factors include radiation exposure, female gender, obesity, autoimmune thyroid disease, elevated TSH levels, and importantly, the genetic susceptibility and the family history present. These factors together highlight why early detection is critical in reducing morbidity. In the UAE specifically, thyroid cancer is among the most frequently diagnosed malignancies, and it is the leading endocrine malignancy. It is particularly more common in women and younger adults. And a major challenge noted here is that many thyroid nodules are asymptomatic and not clinically palpable, meaning that they can go undetected without active screening. While imaging is effective, it is not always accessible for routine population screening. This is where thyroid self-examination, or TSE, becomes relevant. TSE is a simple, non-invasive method that individuals can perform themselves to detect thyroid abnormalities early. However, despite its simplicity, awareness, technique, and practice remain limited. There's also limited data in the UAE regarding public awareness and behavior towards TSE, which makes this study particularly important. Our main objectives were to assess knowledge about thyroid disease and TSE, to evaluate the public's attitudes towards TSE, to determine how many people actually practice it, and to analyze any possible association with family history of thyroid cancer, and to identify predictors of adequate knowledge regarding thyroid problems and the examination itself. Materials and methods. So this was a cross-sectional study conducted in the UAE involving adults aged 18 years and above. We included 382 participants using convenient sampling, and data was collected both physically and through online forms with informed consent. We used a validated questionnaire covering demographics, knowledge, attitudes, and practices, and knowledge was scored out of 22, with 50% or more being considered adequate. Data analysis was performed using SPSS, including descriptive statistics, chi-square testing, and logistic regression, and ethical approval was obtained and confidentiality was maintained throughout. Starting with our participant characteristics and results, a total of 382 participants were sampled, and the sample was predominantly young, with over 70% aged between 18 and 29 years. Females constitute approximately two-thirds of the population here. This indicates that our findings primarily reflect a young, relatively educated demographic, which is important when we interpret awareness and health-seeking behavior. So while awareness levels may appear high, they may actually be overestimated compared to the general population. Looking at baseline thyroid-related characteristics, the majority of participants did not report thyroid disease, radiation exposure, or cancer diagnosis. Only about 6% reported a thyroid nodule or goiter, and a similar proportion had a family history in first-degree relatives. This suggests the population was largely low risk, which is important because preventive behaviors like self-examination may be less prioritized in such groups. When we assess the knowledge, overall awareness of thyroid cancer was high, with more than 80% of participants reporting familiarity. However, when broken down into domains, we observed a clear gradient. Knowledge of symptoms was relatively strong, and knowledge of risk factors was moderate. And knowledge of thyroid self-examination itself was comparatively low. Only about 57% had overall adequate knowledge. This indicates that while participants are generally aware of the disease, their understanding lacks depth, especially in preventive aspects like self-examination. One of the most important findings of this study is the clear gap between awareness and practice. Despite high awareness, around 80% of participants had never received training in TSE, and only about 38% demonstrated good practical knowledge. And the majority reported not performing TSE regularly, and this suggests that awareness alone is insufficient to drive behavioral change, and that the lack of training is a major limiting factor. We then explored whether family history influenced knowledge or behavior. Increasingly, there was no statistically significant association between family history of thyroid cancer and knowledge levels. However, individuals with a positive family history were slightly more likely to actually perform TSE and have received training. Although statistically limited, this trend suggests some degree of increased health awareness in high-risk individuals, but not enough to produce a strong behavioral impact. When we analyzed the relationship between knowledge and behavior, we found a strong and statistically significant association where participants with adequate knowledge were significantly more likely to actually perform TSE, be trained, and have higher confidence. This reinforces a key concept, which is that knowledge is a major determinant of preventive behavior. Knowledge levels also varied significantly with sociodemographic factors. Higher knowledge was associated with younger age groups, female gender, higher education levels, and being a medical student. And this suggests that education and healthcare exposure do play a major role here. In terms of attitudes, most participants perceived thyroid cancer as a moderate to severe condition. Importantly, the individuals who perceived higher risk also and believed in the benefit of screening were significantly more likely to have adequate knowledge and willingness to perform. This highlights the perception of risk and benefit strongly influences preventive intent. In multivariable analysis, the strongest independent predictors we noted were female gender and being a medical student or a student in general. And additionally, individuals with better health seeking behavior were more likely to have adequate knowledge. And again, this suggests that educational exposure and proactive health attitudes independently drive awareness among our population. Here you can see intended health seeking behavior following the detection of a neck lump. And here we described the variables described before: female gender, medical student, any other students, and of course, participants who are likely to take health seeking decisions. To summarize our results, the awareness of thyroid cancer in the population is high, but practical knowledge and performance of TSE are here still low. There is a clear gap, and knowledge significantly influences behavior, and training is a key modifiable barrier. However, the findings overall point toward a missed opportunity here in preventive healthcare, and this can be easily addressed through education and training. Now, for our discussion, awareness of thyroid cancer was relatively high. What stands out immediately is the contrast between awareness and behavior. While a large proportion of participants were aware and recognized its seriousness, it did not translate into action here. In fact, actual engagement with TSC was extremely limited. What makes this even more interesting is that the willingness to perform TSC was still high. So the barrier is not resistance, but something else preventing that transition from knowledge to actual practice. This gap between awareness and practice is actually a well-recognized pattern in preventive health. People may understand that a condition is important, but that alone does not create behavioral change. In our study, even though participants perceived thyroid cancer as a real health threat, most had never even performed TSE. This suggests that awareness campaigns by themselves may not be enough. This is very important. We need something that actively enables people to act. Now, when we look at the role of training and practical literacy again, we can look even further into why this gap exists. A large proportion of participants had never been taught how to perform, and the knowledge of the technique was relatively limited. So even if someone wanted to perform the actual examination, they may not feel confident doing it correctly. And this shows an important distinction here between knowing a disease exists and knowing what to do about it. Another interesting finding was that family history did not significantly influence TSE practice. You might expect individuals with higher perceived risk to be more proactive, but that wasn't the case here. This suggests that risk perception alone does not necessarily drive preventive behavior. It may also reflect a lack of awareness about the implications of family history, or simply that behavioral change requires more than just perceived susceptibility. From a public health perspective, these findings shift the focus of intervention from instead of only increasing awareness to emphasize practical skills-based education. Teaching individuals how to perform could directly address the confidence barrier. In terms of strengths, our study produces localized data from the UAE and looks at literacy, attitudes, and practice all together, which gives a more complete picture of behavior. At the same time, certain limitations were that the cross-sectional design and reliance on self-reported data. Also, since the sample was mainly young and educated, this may show a clear bias. In conclusion, awareness of thyroid cancer was high in our population, but this did not translate into preventive behavior. Practice remained very low, showing there's a clear gap, but this was easily modifiable as the willingness to perform it was high if training was provided. And again, family history was not significantly associated with practice. For recommendations, we recommend shifting the focus from awareness alone to more practical skills-based interventions. Structured training programs can be integrated into educational settings, supported by healthcare professionals. Overall, the goal is to bridge the gap between knowledge and action and promote early detection behaviors. Here are our references, and thank you so much.